So what if I told you the food your kids eat at school could be banned by the federal government, or that some of the most common ingredients in infant formula may be gone by Christmas? And what if Washington was finally going to admit that chronic disease in America is not just a personal issue, but a national crisis? So that's exactly what's happening today. The Trump administration just dropped a 69-page health blueprint that could change how we think about medicine, food, and government responsibility. The Make America Healthy Again Commission, led by Robert F. Kennedy Jr., is shaking up the establishment with a no-nonsense 10-point plan to address what Kennedy calls the chronic disease epidemic. So it's from chemical pesticides to food dyes, antidepressants to vaccines. This report does not pull punches. It's already dividing the medical world, rattling the food industry, and sparking a debate that could determine how millions of Americans live and die. So what's in the plan? Why is the media panicking? And why are public health bureaucrats already scrambling? Let's go ahead and break it down. I bet you it's because they're about to lose some money. I don't know. So, my name's Tom. I'm with the Daily Beltway. I'm also publisher of the Illinois Review and a White House correspondent for the Next News Network. And today we've got one of the most significant policy developments of the year out of Washington, D.C. So, the White House just released the long-awaited MAHA Commission report, Make America Healthy Again. It's a bold 69-page document that lays out a 10-point plan to overhaul American public health. And it's got the fingerprints of President Trump and HHS Secretary Bobby Kennedy all over it. So I got Peter Doocy. He's kind of break it down for us. So let's see what Peter Doocy has to say here. He's reporting from the White House, and when I was out there last week, I missed him. He was traveling abroad with the president, but he's a wonderful guy. I run across him all the time in the briefing room when I'm out there covering things with the Next News Network. So let's check it out.
Harris, it's 69 pages long, and it lays out the roadmap that RFK Jr. thinks federal agencies can use to reduce chronic childhood illnesses in this country. And the top of the list of problems is a poor diet. This report found that up to 70% of food that most children consume contains ultra-processed ingredients.
I think everybody wants to prioritize the ultra-processed food crisis and try to reduce our reliance on ultra-processed food and try to improve the quality of the food, improve the nutrient density of our food. Little children, as they grow up, require micronutrients in their food for brain growth.
Going through the other main bullet points of this report, chemical exposures are a concern, with the authors ordering a study on pesticides by next year, a lack of physical activity and chronic stress, basically kids playing less outside and more on their screens inside, and then over-medicalization, they say. The authors think kids in this country are being over-prescribed drugs they don't need.
A generational accomplishment of the Trump administration will be reversing the childhood chronic disease crisis. It is common sense that Americans aren't chronically sick at high rates because of an absence of drugs.
So, what exactly does this plan do? For starters, it cracks down on ultra-processed foods in public schools. States like Indiana, Utah, West Virginia have already banned certain food dyes and chemicals, and now the feds are getting involved. It's no more artificial dyes, soda, or candy on the government dime. It's about time. It reminds me of that song, my taxes ought not to pay for your bags of fudge rounds. Yeah, you guys know the song. So next, dietary guidelines. Kennedy and Agricultural Secretary Brooke Rollins are rewriting them right now to cut junk and emphasize whole foods. They want the new guidelines to be finalized before the December deadline. So then there's the pesticides. Glyphosate, the chemical found in 87% of kids tested by the CDC, is on the chopping block. The MAHA plan calls for a full review of toxic pesticides that have been linked to everything from cancer to hormonal disruption. And one of the more controversial parts, a review of childhood vaccine schedule. Kennedy isn't calling for bans, but he is demanding gold standard science and transparency. That alone is causing chronic panic in parts of the public health establishment because they want the money. The plan also promotes holistic medicine. And I mean that, yeah, he really is promoting holistic medicine. Like, think gym memberships, supplements, acupuncture, and all of it could be covered under Medicare and Medicaid. And that's a first in the U.S. history. Usually they want to push pills instead of anything that involves you getting up and walking around and doing things. So there's also a push to clean up infant formula, investigate fluoride in drinking water, and get nutrition into medical school training. Kennedy's even working with the EPA to roll back fluoridation policies, something Utah has already led on. It's a massive agenda, and it's not just Kennedy. He's got support from the EPA Administrator Lee Zeldin, USDA, and state governors like Patrick Morrissey and Mike Braun. But it's not smooth sailing. Some within the Trump administration are raising concerns. The farm lobby is pushing back on the pesticide reforms, and critics are asking how you fund a sweeping health revolution while all slashing the NIH's budget. Still, the public response, overwhelmingly positive. I am all about this. My friends are all about this. Everybody I know knows that the food we're eating is absolute garbage. So let's continue. A national poll from the Foundation for Government Accountability shows nearly 90% of Americans support holding drug companies accountable and banning junk food from SNAP. And Kennedy is not slowing down. His MAHA tour across 4 states just wrapped up, and he's gearing up to submit a final strategy by August. So again, if you guys got value from this news update, tap subscribe, hit the comments, like, share, send it off to everybody. I'm going to give a little bit of my opinion. So, I'm still sick from DC. It's lingering. So your support helps us keep delivering real news, and that puts America and American families first. Stay informed, everybody, and stay free. So let me be clear about something. The MAHA report is not perfect. It's ambitious. It's controversial, and it's going to stir up some serious fights in Washington. But it's long overdue, and I voted for it, and let me know if you guys voted for it too. So for too long, our public health system has been run by bureaucrats who answer to industry, not the people. And for too long, families have been left in the dark about what's in their food, their water, and even our medicine. President Trump understands that you can't have a strong republic with a sick population. This plan led by Robert F. Kennedy Jr. puts the health of the American people, and especially our kids, I've got 2 daughters, back in the hands of parents, doctors, and states. And it's going to ruffle some feathers, but sometimes leadership means saying that what's true even when it's unpopular. And it means pulling the plug on a broken system before it collapses. And this is a massive moment of choice. Do we keep letting corporate lobbyists set the agenda? Do we finally demand policies that put Americans first? The MAHA plan is a step toward that option. And if it holds, it could be one of the most important legacies of the Trump presidency ever. Think about it. All these trillions of dollars they've been pushing on us for all these generations, guys. And we have the opportunity to get healthy again and to save our kids and to stop the insanity. God bless.